Hi, my name is Lila Kihas, and this is my project for Sports Medicine 3 on rehab for a hip labral tear repair. What is a hip labral tear? A hip labral tear is damage to the cartilage that lines and protects your hip socket. A tear in your labrum can cause pain and instability in your hip, damages other tissues and cartilage in your joint. If the tear isn't treated properly, it could lead to osteoarthritis over time. The MOI, mechanism of injury, for a labral tear is caused by repetitive movements or traumatic falls/injuries. This is a common injury in sports such as hockey, ballet, football, etc. It could also be shown by falls, accidents, high-impact sports injuries, and etc. The signs and symptoms is hip pain or groin pain, stiffness or limited range of motion in the hip joint, a hip joint that locks, clicks, or catches, and a feeling of unsteady or unstable whenever you're standing or moving. Some people with a small tear have no symptoms and might never know unless it's diagnosed whenever a doctor/healthcare provider sees it. There's also a dull, achy pain that can radiate throughout your leg and lower back. So this is a quick version of how a recommended surgery for a labral repair looks like. But before we watch the surgery, whenever there's a tear, it doesn't necessarily mean that surgery is a required treatment. If there's a small tear, you might only need small treatments like over-the-counter drugs and physical therapy. You'll only need surgery, a hip arthroscope, to repair more serious tears. So here's the video of the surgery. So an arthroscopic surgery is when a small camera is inserted to view the hip joint. So now the surgeon will pass a suture around the labrum. Then a small hole will be made in the bone. Then the suture is loaded into an anchor where both will be placed into the small hole, securing the labrum in place. Then the excess will be removed and the surgeon will repeat the step until all of the torn tissue is repaired. Here are the 4 phases of rehab after surgery. Phase 1 is maximum protection, and this usually lasts from 0 to 3 weeks. Next is phase 2, which is progressing stretching and early strengthening. This part lasts from 3 to 6 weeks. Then phase 3, which is advanced strengthening and endurance training, which is 6 to 12 weeks. And last but not least, phase 4, where they usually return to activity or sports and make a full recovery, but this usually happens between week 12 to week 20. So to go more into detail, phase 1 is where there's usually small exercises for range of motion and isometric exercises. Also, manual therapy is highly recommended during this stage. The goals after completing this phase is hopefully having no pain or inflammation and improved flexibility and range of motion. Phase 2 is where there's still exercises for range of motion, but now we're including strengthening exercises and non/low impact cardiovascular activities like going on the bike. The goals during this phase is to improve muscular health and endurance, progress to full activity and passive range of motion, and re-established muscle control, balance, and proprioception. Phase 3 is where they start including or suggesting a program that can be sport-specific to get them training again. The goals for this stage is to improve strength much more, but focusing the strength on hip abductors and hip flexors, improved muscular power, speed, and agility, and progress to sport-specific activities. And finally, phase 4, where we maintain muscular activation an introduce and progress plyometrics program, as well as having non-contact drills during this time. At this stage is where patients usually start making a full recovery and start returning back to activities/sports, and that's the main goal for this stage. Thank you for watching.